I had an eroded hip. The ball of my femur was finally, the cartilage had completely worn out. So I had bone on bone. I had the head of the femur was up against the top of the socket and no more cartilage. Well, the pain came on suddenly a little over a year ago. It was February of last year. And the pain became so intense that I wasn't walking normally. So part of my syndrome was that I was twisting my spine in order to elevate my hip to advance my left leg. Right? So I had pain radiating down my legs from my back because I had altered the way I was walking and there was too much torsion in my lumbar spine. So that contributed to the overall pain experience, but suddenly I was unable to walk. I wasn't able to climb ladders except, one step at a time. Right foot, haul the left leg up, right foot, haul the left leg up, and so forth. So I couldn't take the grandkids to the park. I couldn't stand. I liked to cook, and I wasn't even able to stand comfortably and prepare food.
You have?
It was an anterior approach, complete hip replacement, total hip replacement. Well, I had prepared for it. I kept exercising even though I couldn't walk or run. I had continued to go to the gym on the and keep my aerobic tone up on the recumbent bike because that didn't hurt so much. But I also did, and I told Dr. Jamali about this, I also practiced meditation for the relaxation response, which suppressed the pain somewhat. Actually, it suppressed it pretty effectively while I was doing it. But I coupled that with some creative visualization where I went back to a time when I felt great and I visualized myself doing normal things. And one of those visualizations had to do with seeing myself recovering and walking around after the surgery right away. I mean, it happened. So all of that helped, I think, to speed the recovery.